very many people talk about molecular classifications. Many people work on molecular classifications. One of the problems of the molecular thing is, of course, it's very helpful, but it's not recommended by pathology because we still lack lots of really hard data, clear facts, and so on and so on. So, of course, we have made efforts with the molecular classifications. We know that there are subtypes of tumors which look like this and have specific, let's say, characters from the molecular point of view. Like they are the luminals, the basals, the stroma-rich, the neuroendocrine-like. So, and we know that several genes are really implied in these kind of lesions. And many researchers, for example, at the very moment, do kind of work on, let's say, neuroendocrine, implied in lots of neuroendocrine stuff at the moment. And we could find, for example, that's not so important whether the tumor is a pure tumor or whether it's just a part of the tumor is neuroendocrine, because probably there are other things which are more important in staging and also in the molecular underpinnings for these tumors. But this is not clear for everything, and I think very many collaborative efforts are still made in these kind of things. With regards to the new treatment, you have these FGFR-altered tumors, especially luminal tumors most of the time. And we know that these patients will have new treatments which work pretty well. So it's really important to recognize these tumors. On the other hand, of course, we will not be able in pathology to test every tumor which is muscle invasive in patients, because in high volume laboratories like ours, you cannot do this because you do not have enough people, you don't have enough machines, it's much too expensive. So my point of view is that we try via the histology to sort out the patients who probably might have this kind of alteration, let's say it like this. And there are several tumors where we know that these tumors are 100% mutated or alterated. We know that others have about 15%. So of course, these are rare tumors. We have to find them from a histological point of view, and then we send them to the molecular pathology to be tested. And I think this is something which could be very helpful in the upcoming years. We still do not know very well what to do with these heterogeneous tumors, because bladder cancer is a very heterogeneous tumor. So what to do if you have 5% of this kind of subtype and 10% of another subtype, we don't really know very well. So these are really open questions which we hope we will be able to answer in the upcoming years. And then of course many people talk about these kind of liquid biopsies as well, urinary liquid biopsies and blood biopsies. The problem is that everybody does a little bit how he or she feels. So we do not have standardized program how to do the testing, which is a shame. And I think it should be done, because otherwise it's extremely complicated to compare the results of the different studies. Because if one does it like this and the other has a completely different technique and another machine, can be a little bit biased, of course. Nevertheless, I think that, of course, this is something which is really upcoming, and it will be very important in the upcoming years, especially for testing, especially in big centers where patients have really access to all therapies which are on the market at the very moment, which is not everywhere, of course, the same thing. We also, of course, are learning by doing. We have these kind of platforms. When we get molecular results, we put these results into the computer, and then we say, well, this is pathogenic, this is probably benign. But as we create more and more data, of course, we become more and more precise. So I think it's very important to do these kind of collaborative efforts to put in all our results in the computer and say, well, listen, guys, this was up to now, we didn't know very well, but now we see with more and more results that probably this is a pathogenic alteration. And I think this is really something which is really upcoming, and I think very, very interesting in the upcoming years. Nevertheless, we all know, and luckily there's still some unresolved problems, so we still have some work to do, some research to do. So staging is not always black and white. Grading, in my opinion, is a big mess, and molecular, we haven't said the last word yet.